Yeah. And what other systems have you seen benefits in?
I really, when you have cancer, especially if you
Mhm.
have the later stages of cancer, um, it's almost impossible to fix. Uh, and but ozone should be 100% of the time. It should always be used along with surgery, radiation, and chemo. Because
Mhm.
when you do that, the following is going to happen. One, you're going to improve your chances of survival by about 30%.
Mm.
It doesn't sound like a lot. It's not 100%, but 30% is better than what we now have, which is 3%.
Mm.
So you're going to have 10 times better results, statistically speaking, when you combine those therapies with ozone. The second thing is that because they enhance your healthy cells and chemo and radiation kill your healthy cells, it preserves the healthy cells. So you have way fewer side effects.
Mhm.
One of the more common side effects from radiation and chemo is infections. It knocks out the immune system and you get an infection. The infection could actually kill you. A lot of people with late stage cancers don't die from the cancer so much. They die from some sort of infection that was induced from the treatments, the radiation and or the chemo. But ozone, since it's such a marvelous stimulant of the immune system, even in the presence of the chemo, you don't get the infections. You literally don't get any infections. You get way fewer side effects, and you get a much better outcome. So it really ought to. It's a crying shame that every oncologist in the country doesn't incorporate this with their patients. And I
Mm.
would encourage all the listeners, if you have cancer, find a doctor in your area that does ozone therapy, so that while you're getting your treatments from the oncologist, you're also getting the benefits of ozone to combine with that. And good story. So a guy comes in to see me. He's a VA guy, and he's got a squamous cell of his throat. And
Mm.
he goes to the VA, and he says, they want to irradiate me. And they tell me if they irradiate me, I won't have any saliva left. The likelihood is pretty good my teeth are going to fall out, and they might fry my esophagus so that I can't swallow.
Mm.
And he says, well, what should I do? And I said, well, you know what? The radiation is very effective for the cancer. So you're going to have to do the radiation. But let me treat you with ozone at the same time, and you're going to have way less chance of those side effects happening. So that's what we did. And at the end of about 6 or 9 months, his oncologist tells him, he says, Fred, you have done so much better than most of my patients in here.
Mm.
You still have your saliva. None of your teeth fell out, and you never really had any problem with swallowing the whole time.
Mm.
We're just amazed at how well you did. So I want you to talk to my other patients and explain to them what a good job we do. Okay. So Fred tells him, he says, I will, doc, but you got to understand, the same time you were giving me this, I was seeing Shallenberger over there, and I was getting ozone therapy, and that's why I did so well.
Yeah.
So I'll be happy to talk to him, but I'm going to tell him what happened. And his response, of course, was, well, in that case, you can't talk to him.
Oh my goodness. Oh.
No kidding. True story. True
Oh.
story. Fred never got to talk to him.